Okay, perfect. All right, well, we are recording, so we'll go ahead and get started. It's 12 o'clock at my time.
Okay.
Welcome to this ISQUAL's webinar presented by Aditi Manke, and it's exploring the link between walkability and subjective well-being in Detroit metro area. I just learned that Aditi is from India originally, but she's been here in the United States in Philadelphia at Rutgers University for a while, finishing up her PhD. So we're really glad to have her here with us presenting her research. Just for everyone who's joining us, you remember that it's recorded, and so we'll be putting this up on our YouTube page afterwards. We'll be sending the link to everyone who registered. During the presentation, we ask that everyone remain muted and also with your camera off to preserve bandwidth. If you have questions, just take your cursor down to the chat bar. Feel free to write any questions that you have. I'll do a sample here. And we'll address that at the end of Aditi's presentation. We'll have a time for questions and answers. So with that, we'll go ahead and turn this over to Aditi and go ahead, get started. Thank you.
Thank you. Hi, everyone. Today, the topic of my presentation is exploring the link between walkability and subjective well-being in Detroit metro area. So, So before we get into the presentation, I would just like to give an overview of about the flow of the presentation. First, like a general overview about walkability, literature review, why I'm doing this research, like what was the idea behind conducting this kind of analysis, the methodology, like the data I used, the variables, and the method I used to analyze the data, results, conclusion, and then in the end, I would really appreciate if you guys have any suggestions on how I can improve my research. I have given my email ID at the end. So let's begin. So what is walkability? Walking is something which is so involved in our day-to-day activity. It is one of the most common ways where people get to go about in their locality. It is positive in many ways, like it promotes opportunities for social interaction between neighbors. It is socially inclusive activity since it is free and it does not need any special equipment. And how walking is determined, or how we get involved in walking, or how it affects our walking pattern or our choice to whether walk or take a car, it all comes from built environment. It has the capacity which will either provide opportunities, it will ease our walkability, or it will put constraints on hampering us to get involved in this activity. So in terms of built environment, walkability is defined as the extent to which walking is readily available as safe, connected, accessible, and a very pleasant mode of transportation. Now, it is a raging concept in urban planning, given that the society in which we are living is more dependent on cars and communities are becoming less walkable these days. So, what is an ideal walkable neighborhood? It can be defined as one where it is very easy and enjoyable to walk, and where the day to day requirements of life are easily accessible within a comfortable walking distance. Now, in terms of like economic viabilities of economic importance or economic advantages of walkability is very much documented in the literature today. But when it comes to subjective well-being, there are very limited research papers which talk about it. So, in terms of well-being, they have indicated that walking improves both the eudaimonic and hedonic facets of well-being. In terms of eudaimonic, dimension, walking gives people a sense of autonomy and contributes in building social relationships. In relation to hedonic well being, research has illustrated that pedestrians have higher positive affect than car drivers. In terms of hedonic, I would like to add that, when you get involved in the activity of walking, there are times that you experience positive thoughts. You it's it's a way it's an activity which relieves your stress from which you experience from your job or from your family life. It's your me time. Like, it gives you a break from your regular life. And obviously there are many health benefits that are associated with walking. Like, many studies have investigated like which physical factors correlate with higher walking frequencies of residents. And with these health benefits, we can say that, or it is plausible to assume that residents of walkable cities would be more satisfied with their lives than residents of less walkable cities. But is that all that we need to make this correlation that people who live in walkable cities are more happy? I don't think so, because you might be living in a walkable city, but there might be different factors that stop you from getting involved in that activity. Like, you might not have access to sidewalks. There are no proper sidewalks. You might fear for your own safety, or there are just not many pleasant scenes around your neighborhood, like access to green spaces or trees, something like that, which will, you know, add more positive thoughts in your mind or in your life. So the purpose of this research was to give more empirical evidence which would link walking behavior and walking as an activity to subjective well-being. The current literature has only measured the objectively measured walkability, which talks about the land use mix, the street connectivity, the presence of sidewalks or not. But that's just an objective part. What about why people like what people perceive about walking, whether they get involved in the activity or not? That is something is missing. And as I said earlier, there are several factors that might stop people from walking on the streets, like, as I mentioned earlier, due to the reasons of safety issues, street maintenance. Sometimes streets are not maintained properly. There are trash cans, people litter on the streets, which might not be very appealing or pleasing to people, or accessibility to sidewalks. This research tries to add to the literature by looking at the effect of walking behavior on overall life satisfaction with health and leisure, while controlling for safety issues and aesthetics of the streets. This research uses secondary data, and it's the Detroit area study, quality of life in Metro Detroit area, which was collected by University of Michigan in 2001. Over in this data set, they have collected data from these 7 counties in the Southeast Michigan region, namely Livingston, Macomb, Monroe, Oakland, St. Clair, Washington, and Wayne. The survey data consists of 4,300 adults, and the unit of analysis is an individual. The survey was collected using probability sample of households and adults of 18 and above from these 7 counties. The response rate for and this survey was collected in 2 ways. One was the face-to-face survey, and the other one was mail survey. The response rate for face-to-face survey was 59.8%, whereas for mail survey it was 56.4%. The method that I used for the data analysis was ordinary least squares method by using the statistical software called Stata. So in this study, I have 3 separate dependent variables. One is satisfaction with life as a whole. Respondents were asked, how satisfied are you with your life as a whole? On a scale of 1 to 7, 1 being completely dissatisfied and 7 being completely satisfied. The same was applied for satisfaction with leisure and satisfaction with health. The independent variables for the study are overall walking behavior index. It goes from 0 to 1, 0 being no walking and 1 being lots of walking. Overall walking behavior index was calculated from the responses that the survey researchers got from walk to friends, walk to park, and walked for exercise. Walk to friend's place was determined by asking, have you walked to your friend's place in the past week? It was a binary variable, no in a no or yes format, no being 0 and 1 being yes. The same was applied to walk to park. Have you walked to park in the past week? No or yes. Walked for exercise. Have you walked for exercise in the past week? No or yes. Now, for each regression model, I had one model which didn't control for these socio-demographics, and I had another table which controlled for these socio-demographics. And the control variables were income of people living in Detroit region, age, marital status, being married, divorced, or single, number of children below 18, race was white, black, Hispanic, Asian, and others. Now, on the left, you can see a histogram of overall walking behavior index. And as you can see, not a lot of people were involved in, in the activity of walking. Almost 25 to 28% people were involved in some sort of walking, and only less than 10% of people were involved in lots of walking. On the right, I have the table of percent of people who were involved in the activity of walking, like walk to friends, walk to park, and walk for exercise. You can see that 70% of people said no to walk to park. It this can this might be the reason that Detroit is mostly a suburban. The survey was collected from mainly the suburban areas, and since suburban areas are not easily accessible via walk or by public transportation, where you can easily walk to a park or walk to a grocery store or something like that. Almost 55% of people said that yes, they did walk for exercise. So you I get an idea that people take correlate walking to health, like they get involved in the activity of walking mainly for their health purposes or for to get some sort of exercise. When you look at the regression tables, on the left, I have a table which just looks at the walking behavior index, which was regressed over satisfaction with life, satisfaction with leisure, and satisfaction with health without controlling for any social demographics. As you can see, walking behavior index has significant and positive effect on all three measures of subjective well-being in this study. But if you look closely, the beta coefficient is highest for satisfaction with health. Like it is 3 times more effective than satisfaction with leisure. And in the parentheses, you can see I controlled for I reported normalized beta coefficients. And if you look at the magnitude of this, of the coefficients, walking behavior has the biggest effect on satisfaction with health. When I control for all the social demographics, the result is the same. Walking behavior index remains positive and has significant and positive effect on all three measures of well-being. Again, on satisfaction with health has the highest effect. The next section, I look at all the walking activities, one like walk to friends, walk to park, and walk for exercise. As you can see, walk to friends and walk for exercise have significant and positive effect on all three measures. But if you look at walk to park, it has positive and significant effect only on satisfaction with health. On the right, in the table 5, when I control for all the social demographics, it's the same. Walk to friends and walk for exercise, even when controlled for social demographics, have significant and positive effect on satisfaction with life, leisure, and health, whereas walk to park has no significant effect on any of these measures of well-being. So when you compare all these three results like life, leisure, and health, walking, it it ties in with the existing literature that walking has physical benefits, and it walking reports higher satisfaction with life when you compare it with satisfaction with life. In the overall mix, there are so many factors that might affect your overall life, but when it comes to health, it's like the physical activity that you get into, the diet you're following. So in that, walking has the biggest effect. In terms of walking activity, as you saw, people who walked to friends place and walked for exercise reported high satisfaction on all three measures of well-being, even when controlled for social demographics as compared to walk to park. This might be because people don't have access to parks, or people have to take a car to reach to a park, which might be cumbersome for many people, and it might take away from their leisure time, the time which was in which they were supposed to do other activities. So I would like to conclude my research by saying that with this data, it was since it was a cross sectional analysis, it only allowed me to establish correlations or associations, and it did not give me a lot of scope to explore the causal mechanisms between these variables. And since the data set is based in early 2000s, I its relevance in current times, like, it's an old data set. Obviously, in over the last 2 decades, walkability has got a prominence in the urban planning scenario. There are urban planners and local government officials who are understanding the importance of walkability, of the importance of providing walkable spaces, a safe place and accessible place, in not only to to combat physical activities or the health, not only to rope in health benefits to it, but also to address climate change issues which are there at the hand. So it, like, improving walkability infrastructure will not only motivate people to take part in the activity, but it will it is a way to address climate change issues. It's a way where people can lead a very healthy lifestyle. And thank you for listening to me. If anyone has any questions or suggestions on how I can improve my research, I'd be really happy to listen to them.
Great. Thank you so much for your presentation.
Thank you.
I see that we have one person with us. If you have any questions, it's EWLAMINIA, and I'm not sure how to pronounce that, but feel free to unmute yourself or type it into the chat box if you have any questions for our observers. So my question to you, Aditi, is just what are your plans, since you said it's an old data set?
Mhm.
Do you have, oh, she does have a question we'll ask in a minute. Do you have any plans for the future in terms of new data, or what are your future research plans?
So my future research plan is to so I'm trying to working with a local urban planner in Philadelphia Like I'm working towards creating a survey for them where they could conduct a similar survey research for Philadelphia, and then maybe I can look at the current scenario for Philadelphia, and then contact any urban planners in Detroit if they would be interested in doing a comparative study between Detroit and Philadelphia,
Oh, good, wonderful. I think
because
that would.
there is not a lot of data which looks at the perceived walkability. Like there are data sets which have like walk scores for every city, but that does not tell me whether people actually got involved in walking or what they felt about walking. Like why do they not get involved in this? Is it is crime a factor? Like they don't feel safe on the streets, that's why they like avoid walking, and rather they take a car to a grocery store or to park.
There, there's certainly a lot of room for future research,
Yeah.
particularly in those two cities. So our participant does have a question, so feel free.
Hi,
Hi.
can you hear me?
Yeah,
Yes, we
I
can hear
can.
you.
Ah, hi, thank you for your presentation. Actually, I also worked on quality of life in the past
Mhm.
on my PhD. And yeah, this name coming from my university account, it starts with BW, but my name is Lida from
Okay.
the Netherlands. And yeah, my question is that because the data set you introduced is pretty old, and I know about it actually because I used to read some literature review from the quality of life in Michigan, and at that time I actually went through that kind of survey. And I realized that, yeah, there are, of course, some questions that I think are missing. For instance, regarding the walking, the frequency of walking, I think, is really important. When you ask people that, for instance, did you go for a walk last week?
Mhm.
They might go, but it might be the only time event. So
Yeah.
it's important to ask the frequency of walking during week or month, depends on how you design your research. And also the difference between walking to park and walking for leisure. I think the difference is a little bit small. So you need to really clarify that for people. So they might not mistake about it. Because I believe most of people prefer to choose somewhere for exercise and refresh, and that the weather is good, that they can see nice landscape, for instance. So they choose park and green and landscape, area in their neighborhood, for instance. So the difference between those questions is a little bit kind of small. So people may mistake that. And I think the importance of designing survey is that you design it in a way that normal people do not. It's really clear for them, and they don't kind of confuse with something else, or Um, yeah, so it should be really clear for them what's the difference between leisure. Uh, I mean, they need to know the exact definition of leisure activity. So walking to park is kind of a leisure activity, I
Mhm.
believe, and it could also be an exercise. Um,
Yeah.
and I think, I mean, as just maybe it's a suggestion for you, it's really good that you design your own survey, because, as you said, there are so many different indicators that are affecting walkability, design of neighborhoods, even the building of the neighborhood, how safe people feel, and the cleanliness of the area, the image of the area. There are so many indicators, and I think they are kind of missing in that huge data set you have. Yeah, that's it. Good luck with your PhD.
Thank, thank you so much. Yes, like there are so many things, and also the problem with this data set was there were a lot of missing variables. So, like, yeah, I do feel that I haven't captured fully on this walkability and subjective well-being, and not just walkability but the other aspects as well, which I'm trying to cover in my thesis. I feel that since I had limited time to finish my thesis, I went for secondary data. But I agree with you that I like, if you need to really capture what people are thinking or what people feel about it, you need to design your own survey.
Yeah, so good luck with your thesis and everything.
Thank you
And I
so
think there
much.
are a lot of space for doing research on walkability, especially in the United States and
Yeah,
some of the places that are really missing the walkable street and pedestrians, especially.
absolutely. Yeah.
Yeah, I definitely thank you so much for your comments. What was your name again? I'm sorry.
Lida.
Lydia? Lida.
Yes.
Okay. And you're in the Netherlands?
Yes. Yes.
Oh, great. Thank you so much
It's
for joining
9
us.
p.m. here, 9:30.
Oh, wow.
And Netherlands is a beautiful place. Like, I have heard stories like where people just walk everywhere. Like, it's so
Walk and
bike
bike, actually.
friendly and walk friendly.
Yeah, biking is more dominant, actually.
Yeah.
It's certainly an important topic discussion, especially as you mentioned, Lita, in the United States. We have pockets of our country that more urban, dense development that encourages walking because it's easier. But in suburban areas where I live in Arizona, walkability is almost nil. I mean, everyone has a vehicle. There's just really, there's no emphasis on walking at all because everything is so spread out. We have
Yeah.
suburban sprawl is what we call here. And obviously we're seeing there is literature that I've come across that correlates walkability in suburban areas and the link between the dependence on the vehicle and life satisfaction. And suburban families are reporting less life satisfaction or lower
Mm.
life satisfaction and
Yeah.
lower well-being because they are so dependent on transportation and sitting in traffic and this and that. And overall just well-being, health, we're sitting in our cars, we're sitting in our offices, etc. So I think this is a very important topic, especially important for people who are interested in community development and urban planning across all spheres. So I think you'll have a lot of future research opportunities.
Mhm.
Um, we have many people within our society who focus on this topic as well. So I'll
Okay.
be glad to connect you with them
Yeah,
um,
sure. I
in the
like,
future.
I'm looking for collaborations. See, like, if I can, collaborate with other people with what kind of data sets they are using, how they are conducting surveys. So yeah.
Well, I think you're off to a great start, and it sounds like you
Thank
have
you.
a great plan for your future research as well. I'm sad that we didn't have the opportunity this past year to meet in person, and unfortunately, because of the
Yeah.
pandemic, I think we're gonna also have a virtual conference in 2021, but it'll
Okay.
be a bit more widespread. It won't just be focused on COVID. It will be focused on
Mm-hmm.
all areas of well-being, and so we'll certainly encourage you to submit your research, and you lead as well. Submit your
Sure.
research for our virtual conference coming up. It's tentatively slated for August of 2021. So look forward to those announcements forward.
Yeah.
And we look forward also for you to do another presentation in the future
Yeah.
after you've defended this one, and
Yeah,
hopefully
definitely.
you can do a follow-up on this research as well. But um, other than that, I really enjoyed it, and I think we really appreciate young scholars getting involved with ISQUAL. So
Thank you. Thank you so
thank you so
much.
much.
Thank you.
Thank you, and we'll be sending you the link for this presentation shortly. So look forward to
Okay.
that, and
Okay.
continue being a part of ISQUALs, and hopefully you'll
Sure.
find value in our society. So
Yeah.
thank you all for
Mm.
participating.
Thank you.
Thank you.
Thank you.
All right,
Bye
I'm
bye.
gonna go ahead and